Good afternoon, everyone. My name is Albertina Nyati. I'm from Eswatini, and I'm here on behalf of UCAP. I will be chairing the session today, which is entitled Implementing TB Recovery Plans Amidst the COVID-19 Pandemic. As we all know that COVID-19 pandemic had an impact on everyone, and even the healthcare systems were impacted badly. We also TB was not spared. We also encountered an increase uh, in lots of people dying of TB. We also have loss to follow up, and also an increase to stigma and discrimination, and also we have drops in TB testing. So that is why we are here in this session, where our panelists will share their experiences from the field, how to strengthen COVID-19 response, how to strengthen the COVID-19 response, or how to strengthen the COVID-19 response for strengthening the TB response. We have a panel of 3 people who are going to be the speakers for our session today. We have Dr. who is from the International Union Against TB and Lung Disease, the TB department. And then we have Ezio, who is from Brazil, and will be speaking about the impact of COVID on TB and HIV in Brazil. Copper will be speaking about community strengthening to ensure healthcare amidst pandemic. And then lastly, we'll have Ingrid Skuman from TB Proof South Africa. Ingrid will be speaking about civil society advocacy for TB recovery plans amid the COVID-19 pandemic. Before we start, I would like us to write our names on the chart. To write your name and where your organization and the country where you come from, and other information that you would like to write. I'm not alone. Behind the scenes, I have my colleagues, Ezio, Ingrid, Madava, and Alexandra, who are also part of the session. Let's not waste time. Can we ask Ezio to share with us the impact of COVID on TB and HIV in Brazil?
Thank you, Albertina. How many minutes do I have so that I like 5 minutes, 7 minutes?
You have 10.
You got cut. 10 minutes? I didn't hear you, Albertina. It's 10 minutes? 5 minutes? I'm not clear. So, well, I'll start. So thank you again for the invite. It's a pleasure to be with you today. I mean, this is my 20th union conference. I have been studying with the union conferences 20 years ago in 2002 in Montreal in Canada, and we have been struggling to have a community space in the conference and having communities participating in the conference since then, and we did a great how to say progress on that. I mean, it's amazing that we have a community connect for these few years. I have been with the UCAP, which I'm stepping now down after a few years, after mandate is finishing. And I would like to share with you a very important work that we did here in Brazil 2 years ago, actually 2.5 years ago, in the middle of the worst phase of the COVID pandemic here in Brazil. I run community advisory boards, which for several studies I have coordinated the stream trial community engagement component of the study. The stream trial is going to have the results announced here at the Union Conference. And I also work with the TB Alliance, helping with the Community Engagement Forum. And here in Brazil, I created the Brazilian National TB Cab, and also I run the Simplicity TB Cab here in Brazil, of the Simplicity TB Alliance study. So in Brazil, I started in 2002, as I said, doing social mobilization, and we have also done a huge progress in this country in terms of creating a social movement of tuberculosis advocates. And we have many of very qualified advocates who come from HIV and AIDS, who have joined the TB effort and have been doing a lot of TB work in these last years, and composing also the Brazilian National TB Cab. These advocates joined and created this effort, which I'm going to quickly present. During the worst time of the pandemic, when the COVID pandemic was about to hit, or starting to hit Brazil, we clearly realized that with a dysfunctional government that we still have until the end of this year, thanks God they lost the election and we'll have a different government as from January. This dysfunctional government was discouraging people to use masks, or delayed the process of Brazil producing vaccines, and the president of the republic saying to people that we shouldn't not vaccinate people against COVID, that it would be just a small flu. And Brazil had lost 700,000 people. 700,000 people officially, because we estimate that at least twice as much have died of COVID for other consequences. And this government, this criminal government, is really responsible for that. And but seeing that we had a dysfunctional Ministry of Health, because some people at the Ministry of Health and the researchers and the public health people saying that we should act in another way, we had a president and a Minister of Health saying the opposite. So we had a meeting by the Community Advisory Board of the Simplicity study that became a national workshop that we did together with the NTP. And it was clear for us that the NTP would not be prepared for the impact of COVID. I mean, they had issued guiding documents for the AIDS and the TB program. So the advocates got together. We had a national workshop, a webinar in March 2020, and with the NTP and many stakeholders in the country, and it was clear for us that the preparedness of Brazil would be a disaster. So we decided, the advocates, we got together and we decided to do a monitoring ourselves with no money. We prepared a methodology to assess what would be the impact of COVID in the TB and HIV programs, or the services, or how people would be affected. So we decided to do an assessment that analyzed what would be the perspective of the programs, coordinators, the frontline healthcare workers, and the users. We don't use the word patient. We use, in Brazil, people who use the unified health system, because in Brazil we have a universal access. So people don't have to pay for the services, the public health services. It is called the unified health system. So the people who use the service, we call them users of the unified health system. and we don't we from the community we don't like to use the word patients or so, because patient is a relation between medical doctor and the patient. And we decided to do our assessment, assessing what would be the perspectives of the impact for the programs, for the frontline healthcare workers, and from the users. And we got completely different perspectives. In the middle, it was a huge work. We actually had like three how to say uh, um, uh, waves to assess how the impact was going. So we assessed 500 people on treatment for TB and HIV and AIDS in all the macro regions of Brazil. Brazil is divided in 5 big macro regions, which is the north, which is the Amazon region, Midwest, where Brasilia is the capital, northwest, where Salvador, Recife is, southwest, which is where Rio and São Paulo are, and the south of Brazil, where Porto Alegre, Rio Grande do Sul, and Santa Catarina are. So we assessed people on treatment for TB and HIV, 500. So when we hear from researchers that they cannot do assessments with more than 5 or 10 people because it's too much work, I mean, we did with 500 people 3 times with no money. So it is possible. The communities can do that. We issued, and while we were doing this work, I mean, the WHO decided to support us for the second part of the work, because we did that, I mean, overnight. I mean, we were not overnight. I mean, it took months, many months. It was from March until December when we issued and we released that. So I shared this PDF. It's in English, the final report that we issued on December 18th, 2020, and has all the results of that. So I am just highlighting this document. I'm having difficulty to continue. How to say, to show more. I don't know why, but it was showing, but now I can't show the more of the document. But I don't know what's happening. But do you see my screen, right? But probably you cannot see more than the front page. But I'll share the document with you. The PDF I sent already to Madhava and to Albertina, and what I would like to say is that we showed clearly that we were the first, the communities were the first to show before the government that the impact on the diagnosis and the follow-up of people in treatment for tuberculosis and HIV and AIDS had a hit already in June 2020 of 40%. So the government presented that right after we did. I mean, so the assessment that we did was correct. So the impact was tremendous. That was the beginning of the pandemic, and we continued. So we assessed data until October 2020, and we presented the results in December 2020. So what I want to say with that is that the communities can do how to say, can monitor with very qualified aspects. We did a survey that was collecting quantitative and qualitative data. So it was tremendously important. We unfortunately were not accepted for publication. A journal has refused because it was like a community work. So I mean, we have still having trouble to publish this document, but it was extremely important. I will share with you. I mean, and probably for the reason also that we are sharing the document, the journals don't want to publish. But for us, more important than any journal and any scientific publication is that we, from the communities, we bring awareness, and we produce data. So that's what I have been working in this last 20 years, is to show that the communities can produce information. The communities can produce evidence, data, and it is different from the way sometimes the scientific world do, because the communities have a different approach. I mean, and we do things with, I mean, incredible, reliable, and documented, and well documented, and things. So we use it. The WHO was very supportive of the work we were doing. We had a lot of support also from PAHO. We had the support also from the NTP. We have to say, although we had we have a dysfunctional government and a minister of health who are a disaster, and was worse at the time. We had the support from the NTP. I have to highlight the Brazilian NTP has done all the efforts possible to go through this nightmare we have been having this last 4 years in this country with this government. But the NTP is trying to do whatever they can, and they have been very collaborative. They were very supportive, but obviously they are under a government that they have to respect and follow. But what we did was WHO supported us in doing this work, and so we did, and there was a very good timing with the UN report for the agreements that the high level meeting of 2018. In 2018, there was the high-level meeting on tuberculosis at the UN. So many heads of states and heads of government had joined in New York to establish we agreed with targets for NTB, the NTB strategy, and how countries should act. And then came COVID after that. But in 2020, despite COVID, the UN Secretary General presented a progress report on the TB recommendations from the high level meeting 2 years before. So that was in September 2018. So we aligned the results of our assessment together with the UN Secretary's report. So he presented 10 priorities, and we compared the 10 priorities also at the end of this report. This report is very detailed, has lots of data, important data produced by the communities again, and with no money, and we aligned that with the recommendations that the country should be following, and that what countries should do. So what I want to do with that is to show clearly that we can produce a document. It's a hell of a work, especially when you don't have the funds and you don't have the support. So we had to do, we were working for months for 16, 18 hours a day, Sunday to Sunday, to produce things. It was horrendously exhausting year. But we did that because we had to do our work and all the extra work. Everybody closed at home. Everybody had the same situation all over the planet. But what I want to say is that this was a concrete document from the communities that we produced, that we are very proud of in this country, and that the government was present, they supported, but they basically ignored the document. They ignored the document. We even heard in along 2021 after we had already presented and we presented for when we did the workshop in 2020 in English, it was like 180 people present. In Brazil, there was over 200 people listening to the result of our assessment. And still, the government was saying that they ignored the document, obviously, and it was we gave very clear recommendations of things that they agreed to do. We just reminded that that was their business, that they should be doing, that they were not doing. So this is a clear shown that even when people are collaborating and they are supportive, sometimes they do nothing or they ignore the work that you do. We heard from people from NTP absolutely saying like, oh, but the community should do something. We did a tremendous document. We did a tremendous study in the worst possible conditions with no support. And we created a tremendous outcome. So I will end here. If somebody wants to pose a question, I will share the documents because time is short, and I have already passed the 10 minutes that I had. So I will share the document, but this is just to share again and document that. Yeah, that it's no blah blah blah. I mean, the communities can do real work, real significant work, although sometimes the acknowledgement is weak. So thank you very much, and looking forward to hear from you.
Thank you so much, Ezra, for sharing the experiences of COVID on TB and HIV.
Hi, thank you, Ezio. I see Albertina's connection got cut out. And Ezio, there are some questions for you in the chat. It's really interesting to hear from Brazil because it's also a different political environment. So we look forward to reviewing the report. Thank you. I would like to now introduce everyone to Copto, who's the TB director from the union. So in Community Connect, we're trying to bring scientists and the civil society together more and more. And that's why this panel discussion is our opportunity to also get a lot of technical input. And we're happy to have you with us, Copto Kura. Thank you.
Okay, thank you, Ingrida. I hope that colleagues can hear me. Okay, so I'm Kopto Kura, medical doctor, public health specialist with 15 years of professional experience. So I'm expert in planning, designing, implementing, monitoring, and evaluating strategies and policies for the prevention, detection, and management of TB in adults and children. So my background includes research, technical assistant, and delivering international courses for health professionals. Okay, so for this session, I will address 4 items. First, share with you the global impact of COVID-19 on TB control. 2, share with you the strategies the union and other partners we implemented to mitigate the impact of COVID-19 on TB care and control. Third, highlight one neglected element in the management of TB, the community, the crucial role of community, and finish my speech with the union vision and strategy to end TB for 2022 to 2027. So 2022. Okay. So for the first item, what about the global impact? So I will, Ezio has already shared with you the impact of COVID-19 in Brasilia. So, and we have several publications regarding the impact of COVID-19 on TB. And we can say that COVID-19 pandemic has caused health, social, and economic impacts on TB since 2020. So this includes impacts on the provision of and access to essential TB services. And as you can see, the last WHO report, you had the number of people diagnosed with TB and notified as TB cases through National Disease Surveillance System decrease decrease the number of and this indicator reflects impact on access to diagnostic and treatment on both the supply side and also the demand side. And globally in 2020, there was a substantial fall, 18% in the number of people newly diagnosed with TB and reported to national authorities compared with 2019. And there has been a partial recovery in 2021. So regarding the global number of TB deaths, it's estimated to have increased in both 2020 and 2021, while the historic decline in the TB incidence rate slowed in 2020 and then reversed in 2021. So they have other impact associated with the COVID-19 pandemic, like 15 decline in the number of people enrolled on treatment for drug-resistant TB, reduction in spending of TB prevention, diagnostic, and treatment services in both 2020 and 2021 compared with 2019, and a worsening on the global coverage of the BCG vaccine among children in both 2020 and 2021. So uh, this is you can find all this information in the last global global tuberculosis report published each year by WHO. So we all agree that COVID-19 has a serious impact on TB care and control. So during this period, in April, this is the second part of my presentation. So in April, several partners, WHO TDR, the Access and Delivery Partnership Project, Damien Foundation, WHO Global TB Program, and the Union, we worked together and we launched an initiative to help countries in West and Central Africa to evaluate new and adapted strategies to mitigate the impact of COVID-19 on TB care and control through implementation of operational research. So, we 11 projects were competitively selected, and to summarize, in Cameroon, Chad, Côte d'Ivoire, Niger, and Togo, NTP and researcher and also community, they evaluated the effectiveness of community-based TB treatment compared with care delivery by health facilities. So in Benin, Niger, Senegal, novel tools such as teleconsultation and e-technology for program monitoring and training have been studied as way of mitigating the impact of the pandemic on TB care services. And in Guinea and Niger, COVID-19 pandemic is being used as an opportunity to expand the TB screening to patients suspected of being infected with COVID-19. So I would like to spend more time on the community-based treatment project implemented by Togo. So the objective of this study was to determine the contribution of community dots in the TB treatment outcome. So they performed a prospective cohort study from April to July 2021 in 8 health facilities. So 4 intervention and 4 control sites. So a total of 182 patients were included, 91 in each group, and the preliminary results are the proportion of for all these population, the TB patient, the proportion of HIV positive were around 15%. So at month 2, 92% of TB patients in the intervention group where the community have been mobilized to provide treatment. 92% of TB patients had a negative Bacillus smear at month 2 compared to 67%. So 92, 67 in routine. So and the difference was significant. So so currently they are analyzing the treatment outcome at the end of treatment and also perform a qualitative study. So this is one I would like one concrete example of how the community we had a positive result, I can say, with this operational research. And the third part of my speech is the transition, the role of the community. You know, local, non-governmental, and other civil society organizations have historically been neglected in the TB response, and yet they can play a vital role to support the TB program to ensure effective communication about TB, COVID, and also they can also sensitize community to continue to attend health services, TB prevention, diagnostic, treatment care, like the project I've just shared with you. And given the importance of continuing care, the role the role of the community is very crucial. And we think that an integrated plan to mobilize the community to fight against both disease, not only TB, but also TB and COVID, both may be more cost effectiveness than separate approaches. So to finalize my speech, I would like to spend to share with you the union vision and strategy to end TB. So since February, all the union collaborators throughout the world, we work together to elaborate a vision and a strategy for the from 2022 to 2027. And the board also the board approved this work on this, and then the final version shared with the board was in August. So just to let you know that we identify 6 strategic objectives, and one of them is the engagement enhanced community engagement to prevent TB affected families from facing catastrophic financial and social costs due to an episode of TB. So just to say that for the union, it's important for us to work with the community in the field to achieve for TB control. And the cornerstone of our approach will be to expand community engagement and support community leadership of effort to end TB. So we do this by working with persons with TB and civil society, and by partnership with multilateral organizations and national institutions. So and we will include affected people and community representatives in the decision-making committee of our projects. So sorry, I think that I will thank you. And over to you, Albertina. Yeah, I will respond to your question. And if you want to discuss with us later, do not hesitate to send us an email. We are totally open. So over to you, Albertina and Ingrida. Thanks.
Thank you so much, Gopto. I put the link to the TB strategy from the union in the chat in case anyone wants to read through it, but it's really encouraging to see that community engagement is a vital part of the TB strategy. So thank you, Gopto. Over to you, Albertina, sorry.
For being cut. So can we to answer question that is saying what would the reason the document not publish? Is it through not filling research procedures or already they similar more still available?
Albertina, I think you have a bad internet connection, and I would suggest Ingrid to take over as chair.
Okay, so and we have to Ingrid.
Thank you, Albertina. I see there's one question for Ezia. What would be the reason for a document to not be shared in a research publication, if you want to respond to that? Thank you so much, Gopto and Ezia, for your presentations. I think I'm still learning also how community engagement is vital to part of the union's TB strategy and what our role is. And I think we're learning about each other's roles through Community Connect and what the advocacy work is that other partners are doing so that we can draw on each other's shared lessons learned to move forward. And I just want to share a brief example from South Africa about advocacy that we did amidst COVID-19. So I'm part of TB Proof, and we're a TB advocacy organization. I'm also a TB survivor. And similar to what was found in other countries, we were also all horrified to see the decreased TB services, access to testing, and increased deaths amidst this pandemic. And therefore, we used a multi-pronged advocacy approach where we use this framework. So it's also a scientific framework for advocacy evaluation. It's by Kaufman and Beer, and it's really helpful for us to start at a point where you think, okay, at the end of the day, we want to see policy change. So where do we start? And increased knowledge is really important to create demand, and that is where TB Proof started with our advocacy to get the release of the TB recovery plan, because it was drafted when the pandemic started, and then a year and a half later it was still in draft. So we wanted that policy to be released and implemented, and we started raising awareness about TB amidst COVID and build advocacy capacity so that we can have mobilization of public voices. And then at a higher level, so that was at community level, but then we also engage with stakeholders and political leaders to get more coalitions and political support, because at the end of the day, you need a sustained advocacy with one collective advocacy goal. You can't do it as one organization or one individual. So we really try to focus on collaborative action with other partners. So for community-based demand creation, we use the media where we created attention. And there's a spotlight article that was published, and it was published together with previous national TB program managers, so that it's also not just civil society asking for this, but a diversity of voices, including high-level leaders. We were part of other campaigns, and we started developing advocacy briefs about the TB recovery plan, because we had access to it, but we knew that actually people in the community, they can't access this recovery plan, so they don't know what to advocate for or what should be available to them. And then we're planning to do a whole Think TB campaign for World TB Day next year. So decision maker levels, it was very important for us to work with the South African National AIDS Council. So SANAC has a civil society forum, a TB task team, and that is co-chaired by our deputy president. So that's a direct avenue to a policymaker that we could use when we developed an advocacy letter calling for the release of the recovery plan and its implementation, and it was supported by 29 organizations, sent to the Minister of Health, and that secured a meeting between us and the Deputy Director General for National Health Insurance, where we could present these asks and make a case together with other partners like Treatment Action Campaign and SANAC to get the policy released. We also serve on the National TB Think Tank, which supports the Department of Health, so we could use that high-level platform for advocacy, and engage with community members, community health workers, and then the local health committee members that lead the Department of Health, specifically for HIV, AIDS, STIs, and TB. Another key influencing moment is that our National Strategic Plan is in a new phase now. So we use those opportunities to again make sure there's alignment between the recovery plan and the National Strategic Plan being developed. And then this year, the National TB Director released the TB recovery plan with 4 key interventions to reach people with TB, link them to care, support them to be treated and cured, and to ultimately prevent TB in our communities. But so this was a real advocacy win for us after so many months working with partners to get it released. And the next step will now be to focus on accountability, because I think all of us sometimes see a policy that is really high quality and you could almost feel the results that could happen because of it, but then you see the delay in implementation. So at the moment, TB Proof, we're conducting stakeholder interviews, trying to find out what are the TB priorities in the recovery plan, and also raising awareness of the recovery plan with different levels of stakeholders, so that when we have accountability platforms, we want community members to be very informed about what is the recovery plan, what services should be available, what are the priorities for the community, so that can inform budget allocation with the recovery plan, and also how the staggered approach for implementation that will be followed. We're doing community workshops with local community leaders, traditional healers, school teachers, because we believe that they are trusted in the communities, they speak the local language, and by getting them onto clinic committees and into higher level platforms, they are representative of their local community, and we need those voices to, without any power dynamics, to call on the government for accountability for policy implementation. Thank you very much. So I'm not sure, Albertina, if your connection is okay now, but otherwise maybe we can ask if there are any questions that we can still answer. I think especially if there's someone who has a specific question for Copto about the union or the TB strategy, now is a good time to ask. Or if you want to share any examples of your organization's work amidst COVID, please also share that in the chat.
So maybe if we don't have any question, but I would like to highlight again that it's important for us to involve community in our activities. It's not only it's not just only the by word, but all, as I share some concrete example with you. And another thing the union is doing in for our courses. Our courses, for example, we have international courses on TB, French international courses, and we involve one member from community to prepare educational unit on community, because the course is for health professional, but we say it's the good opportunity to involve someone from community to deliver educational unit, and it will and by this way the health professional, they will be sensitized by this, so that and we do it for our international course on TB and also our MDR TB courses, but it's in French, in French area. Yeah, but we are trying, we hope that we will continue to work end to end with the community to achieve our goal. And one last thing also is important. If you ask a question to many health professionals, they think that community is healthcare workers, community healthcare worker, but not. Community is very vast, you see, and maybe and it's not just healthcare, community healthcare worker, it's a system. You have several civil society, so that um, yeah, we should, it's important to let people be aware about.
Thank you, Ingrid. If I may, I just would like to answer some one of the questions, which was about why the study hasn't, the community assessment hasn't been published. I mean,
So
this is the kind of difficulty that we have when we have to publish something from which is produced by the communities and not by a scientific institution. It was done out of the. Although we have followed all the methodological steps, we have everything very clear. We had to face we faced some difficulties, and we had approval. Even we had actually a waiver of the ethical review by PAHO, that was we also submitted that, so we followed all the steps, but still we had to adjust so much of the studies. And the problem is that sometimes the communities do a work without proper support, and we have other work to do. I mean, as I said before, to produce the assessment that we did in 2020 costed us a tremendous effort. Tremendous. It was like months working. I'm not kidding. I'm not exaggerating. 16 hours a day. So it was, and when we come with the results, and we have to adapt because we don't do that for the sake of publishing. And for the academic world, important for us is to share. And as I said, we had about 180 participants in Portuguese and Spanish, and then we had 150 or 160 in English. We had two presentations in 2 times in different languages. We had also a translation during the presentation, so it was widely shared. We shared with all the reports, etc., widely, and that's a problem. So this is an aspect also that the communities have to be how to say, recognized or acknowledged. It has to follow some scientific steps. So how do you adapt that? How do you who is going to take care of that when, for example, you don't have any financial or administrative support to do that? So that's the kind of problems that the communities have to face, and this to produce data which will be scientifically accepted. But even if you do with following all this stuff, I'm obviously a researcher. I work with the Brazilian TB Research Network, but it is difficult for the communities to be doing all the parts. So I think it is. Thank you, Damali. When I speak about the communities, I'm talking about communities affected. I'm not talking about the research community. I'm not talking about a community of specific. When the community, when we speak, we people affected. I am a person living with HIV for over 35 years, and had TB twice, so I'm also a person affected. So when we from the communities talk about the community, we mean the communities affected. We are talking about people who are vulnerable or have been affected by a disease. So that's what I'm talking about. I just to let thanks, Sister Mary Josephino. Wonderful to see you here, and many other friends and colleagues. But we have to follow up, and we're still struggling to do a lot of publication and a lot of data that the community produces, and it's difficult. I must say that it is hard for us sometimes to move forward. Thank you, and thank you for your support.
Okay, thank you. Just to complete, for ASIO, I think that it's community affected, but for the union, we are not just limited the community for the affected people, but you have several other civil society who and they could be involved on TB control. So we have one question, not in the chat, on question answer, but it's in the chat regarding could we term the community as social scientists. So I think that it's more than just not just limited the community as social scientists. You have several activities, intervention that the community could be involved on TB control. And maybe you engage TB. WHO has published a guideline engage TB, how to implement strategy to work with community and identify the process, okay, to involve community in our activity. So you can check this guideline if you to have more information. Okay, over. Thank you, Ingrid.
Thanks, Copter. The one thing is here, what you mentioned, I think it's an important point that it's not sustainable to work 16 hours a day without funding for community work, and that is use. It's great that you can share the report with us, because even if it's not published work, those reports, when shared with the Department of Health or the Ministry of Health, it's still an advocacy tool, and it's still based on data. So that strengthens our voice. And I think those types of reports, we've come a long way, because it's not just someone's view. It's such a wide, it's a coordinated effort. And I think in civil society, over the years, what I've learned is like it's so important to have strategic partnerships, because everyone's strength is different, and to go at it alone is not effective. Advocacy doesn't work like that. And that I'm glad that you are sharing with the report and your findings with us. Thanks.
Yeah, thank you.
Ingrid? Yeah, I know that we with several minutes left, but it's important. I would like to take also the opportunity to share one message. If we all could work and advocate to try to include in the countries the within the Ministry of Health one a community system. This will be useful instead of you have several NGOs who would like to work on TB, but uh, this is for sustainability, and some countries has already experienced this, and it's very important. So let's advocate. Yeah, Ezio, I think that you would like to say something regarding this. You activate your
Yeah,
microphone. Yeah.
Copto, it is very hard for us to think about a community system, because this is a terminology that I still don't get. Because for as a community system, I call it a community movement, which is uncoordinated. I mean, where people can join and produce something together. We did that in HIV and AIDS, although in HIV and AIDS we have committees, conferences, etc. Same we have in TB. So we follow more or less the same story. But how do we establish a system when these organizations are not funded, when you don't have support for them to exist? So when you struggle to keep to have a production of something which can be accepted for by other persons, so how do we establish? There are countries which don't have. Let's talk about different regions in Africa or in Latin America or in Asia or in other parts of the world. There are countries which don't have a health system. So how do you establish a community system? What do you mean by community system? What if I say that? Let's establish a community, how to say, connection, and to have to build something together. It's fabulous. I saw that there are many people from the Desmond Tutu Center here from Cape Town. I'm very glad to see you around. I mean, in March, early March, we will be in Cape Town for the dissemination of the impact, the results of the study by the BRICS, which is led by South Africa, which is about the impact of COVID in Brazil, South Africa, Russia, and India. So this will be in Cape Town early next year, and I hope to have you all there. But for example, South Africa is an excellent example. South Africa is the country in the world which has most community advisory boards, but they hardly communicate among themselves. South Africa has a tremendous capacity in social mobilization. South Africa is probably the richest country in the world in terms of community advisory boards, of civil society representatives, etc. But absolutely uncoordinated. So how do we do that? I mean, we are trying from outside to also to help. I'll be trying to establish a workshop among communities and CABs in South Africa in March. I'm talking with partners in South Africa to do that. Definitely, the Desmond Tutu Center colleagues will be on board. That will be communicated, and hope to join this effort. But this is an example, Copto, of this difficulty of creating a system. If you have a country like South Africa, which has resources, South Africa is the country which more receives resources on the planet in terms of investment in research and in other and support. So with a country full of support like South Africa, it's difficult to establish that. Imagine in a country with no funding. I mean, here we have to struggle for the communities to have some funding from the government to do some specific project, to be able to do other projects, because that's how we work. I mean, we do something that pays us, and we do a lot of other work which is unpaid. So that's our life. I mean, so we are not structured as a research institution that we are paid a salary and that we will be able to produce something. Communities work differently. So, and that's our difficulty. I am in the communities and the social movement of HIV and AIDS since 1988, and I was the pioneer of community mobilization in tuberculosis in this country and internationally in 2002. I participated the first formation of TB advocates back in 2002 in a union conference in Montreal, as I said in the beginning. So it's very difficult, Copto. It's sometimes I get disturbed by some terminology that comes out of Geneva or somewhere else, or Washington or somewhere else, that pops up with a brilliant word like, let's do a community system. I mean, we don't have community support for basic organizations. So how do we move with that?
So,
I mean, the Francophone Africa don't speak to the Lusophone Africa, which doesn't speak to the so I mean, how do you manage that?
I think that we are not going to answer the question here, but what I would like to say is regarding the sustainability of the community involvement. You know, we it's not good to say just focus on TB. What I would like to say is political engagement, its commitment is important. That one country can say, okay, I will have within the Ministry of Health a department for community, so to structure the community around this. So then all of the disease, not only TB, so try to think about this kind of system. So this will strengthen the implication of the community, not only on TB but other disease. So that's what. And I know that some countries in Francophone Africa, it should become from a high level. You see that. But we can continue the discussion later. So we exceed the time. Yeah. But I know that it's very difficult. But let's have an hope. You see.
I think maybe easier if you don't mind posting your email address in the chat. There are some colleagues that agree with your point, and maybe next year for Community Connect we should have a specific session on this type of on community systems, because it seems like there's a lot of discussion that could be discussed in a passionate way.
I'm happy to announce that I'm going into a small how do we call that sabbatical by the end of this month, because I'm completely worn out. So I need a long break. Not talking about TB, not talking about HIV, or I will do something else. Another bubble. So I will jump into another bubble for a few months. Otherwise, I'll collapse. And hope that next year we can collaborate more. So thank you so much. Bye bye.
Thank you so much, everyone. I learned a lot. Thank you for your time.
Bye.
Bye bye.